Now this is an area not a lot of people will scan, but I'm going to show you the triceps insertion onto the infraglenoid tubercle, okay? Now I've had a few patients, particularly climbers, and our model today is a climber, and they've been getting pain at the back of the shoulder, had MRIs, all pretty normal, but when we look at the triceps we can see some changes. So first of all, to find it, just place the probe transverse on the humerus. We know that's the humerus because it's round. See infraspinatus on top. Make sure you tilt the probe to get the bone nice and bright. Can you see I've dropped my frequency all the way down to 10 because it's quite deep. You must drop your frequency. Then just having a look at the probe, as I come round, what's going to happen is the humerus will fall away and the next bone that will come up will be the glenoid. So just keep your eye on it, and then as we come off the humerus, our eyes go further down and we can see the next bone, which is the glenoid. Now, can you see a structure coming off the glenoid here? This is the infraglenoid tubercle, and this is the triceps insertion, and we can see it here. Now, can you see it's a little bit darker here? It's exactly where his pain is, but what's the clue that there's a problem? It's this cortical irregularity, so it's an enthesopathy of that triceps, proximal triceps attachment. If we just fishtail, and what I mean by fishtail is keep the top of the probe still and fishtail the distal side, then I can actually line up those fibers really nicely, and I can see the tendon coming all the way, and as it attaches onto that bone, you can see it's a little bit thicker, and we have checked that on the other side, and there's certainly more cortical irregularity, it's more hyperechoic, and it is thicker. You can just freeze it and measure that attachment if you want to and compare that to the other side, but this is certainly where he's getting his pain, and as he's a climber he's obviously using this tendon an awful lot.